and from Microbiology Society and Department of Microbiology. We are very thankful to you, sir. So I request you again to kindly deliver your talk.
Thank you, Dr. Nagendra. I hope I am audible to all of you. Hello.
Yes, sir.
Hello.
Yes, sir. Yes, sir. Audible, sir.
Okay. So thank you, Dr. Nagendra, and thank you, Dr. Deshmukh, for giving me this opportunity to speak. My association with MSI is very, very old, as sir has already informed. And with sir, it is much more older than that. So it's really a wonderful opportunity to speak on this occasion with the kids of Sikkim University. I recently visited there and I realized that there is a need to do this kind of activity in Northeast. So I'm really thankful to Dr. Nagendra to initiate with the support of MSI this kind of activity in Northeast. And coming directly to my presentation, so can you see the slides?
Sir, not visible.
Not yet visible, sir.
You again stop sharing and again start sharing.
Is it visible now?
No,
Not
sir.
yet.
No, sir. Not yet, sir.
There seems to be some internet problem.
Yeah, I'm again retrying it.
अच्छा तुम इसको स्केच पेन से तो कर दोगे ना मित्र और बनाओगे नहीं वो तो मिट जाएगा पेंट हो जाएगा
Is there any problem in sharing?
Is there some issue also?
It is not being uploaded. Actually, you can share. I allowed you to share the PPT. You can send the PPT to Dr. Nagendra. He can
Yes,
present.
sir.
That is also alternative.
Yes, sir. Definitely.
If there is a problem, you can send the PPT by mail to Dr. Nagendra. He will present it. Actually, there should not be any problem in sharing your screen. And today's event is being recorded and it is live on YouTube also. And I'm happy to see more than 36 participants are there. Megha Kulkarni ma'am is also there. Very good. Lalit Chaurashia. Satyanarayana sir is there. Neha Joshi. Then Priyanka Upadhye. Wi-Fi. Santosh Kumar. Very good. Satish Kumar Pandey. Shanmugam is from Tamil Nadu. Very active president of Microbiology Society for Tamil Nadu. Sayyak is also there. Very good. So very nice to see this. But is there any problem, Dr. Shailendra sir? Shailendra sir is has joined again. Okay. Shailendra sir, is there any problem to you? Please tell me if you are having any problem. Shailendra sir. Saxena sir, do you have any problem? I think he has not joined, correct?
Yes.
Dr. Nagendra? Shailendra
Yes,
sir
sir.
has joined. Very good.
Yeah, it is showing
Yes,
that
sir.
host disabled participant screen sharing.
Oh, yes. Please stop sharing any participativity sharing. Please stop sharing. I request all participants to stop sharing.
No,
But
someone host has to enable me to share.
I will allow again.
Yes, sir.
Okay. So I allowed you. Please share your PPT. I allowed you.
Okay.
Share your PPT. It's a very simple to share the PPT.
Yeah.
Sir, technology is really good, but sometimes it can be difficult also.
Correct.
Sometimes
it depends on internet. It depends on other
so
settings.
many factors, sir.
Yes. Here means there is a notice that Shailendra Saxena has started screen sharing.
Yeah.
Yes, sir. It is
Yes,
visible
sir.
now.
Now we can see the presentation.
Yeah, that
Very
was the
good.
problem last time also.
Yes. Sir, you can start now. Please start, sir.
Yeah. Just 1 minute. So today I'm presenting some of the work which we are doing with the COVID-19 since it started, even before it started in India. And
Yes, sir.
yeah. So all of you might have seen this movie called Three Idiots. And you might have seen the name of the professor, Buddhe. And that was the name given by the students, showing the importance of the world viruses in the lives of the students. And nowadays you might have seen that anything which becomes popular is also known as that has become viral. So the people have taken the viruses not only in terms of just infection, but also in terms of like super virus, computer virus, and so on. Am I audible to all of you?
Yes, sir, you are audible. And I request all the other participants to kindly unmute yourself so that there should not be any different disturbance. And sir, kindly go ahead, sir. Thank you, sir.
Okay. So that's how the popularity of this word has initiated. And this work was done when the IIM Ahmedabad was doing this movie. They came to CCMB and they started looking for a new name. And from there we started this word called virus. So all of you know that what is there in the name. As COVID-19 virus, pandemic coronavirus, and so on has been given. But the official name of the virus is SARS-CoV-2. That means the severe acute respiratory syndrome coronavirus. And this is given based on phylogeny, taxonomy, and there are various established practices which is given by the coronavirus study group of ICTV, that is International Committee on Taxonomy of Virus. This is the biggest body, just like IUPAC in chemistry we have ICTV for viruses. And I'm also the member of this committee. It's an international body which gives the nomenclature of the newer viruses. So the COVID-19 is an infectious disease which is caused by the newly discovered novel coronavirus. This virus has been quite new in the humans, although we know coronaviruses in animals from 1930s. However, in the human, we know from 1964 onwards. So some of the coronaviruses which we have seen in humans are 229E, NL63, OC43, HKU1, and so on. And the diagnosis of these classical coronaviruses, then the novel coronavirus which we have seen, SARS-CoV-2, SARS-CoV-1, and MERS, is quite different. And the patients with COVID-19 are evaluated and cared for differently than the patients with common coronaviruses, because the common coronaviruses are not fatal to the humans, and they cause that we are not bothered for it in these four names. So if you look into the history of the infectious pathogens, you see there have been a lot of viral infections which have caused major havoc in the last couple of centuries. You can see we have bubonic plague, we have a smallpox, we have cholera, we had a Spanish flu, Russian flu, and very recently we have seen HIV and AIDS, which have killed around 25 to 35 million people from 1981 onwards. And then now we have COVID-19 and SARS, Ebola, MERS, swine flu, and so on, which you have seen in 21st century itself. Now, if you look by the death-wise, more than 200 million people died because of the bubonic plague. Whereas if you see here, the swine flu, yellow flu, Ebola, SARS is quite low.
Excuse me, sir. Just a second, sir. I kindly request everybody to unmute except Salendra, sir. Please.
So you have to say mute, not unmute.
Please, sorry. Please mute everybody. Please. Okay, sir. So I'm really sorry, sir, for this disturbance. Kindly go ahead, sir.
Okay. So these are the some worst pandemic of the world history. If you see the mortality wise, then the Ebola is killed around, the fatality rate is around 40%. Nipah has around 77.6%, and MERS has 34.4%. whereas SARS, which we have seen in 2000.
10 वेळेस सूचना दिल्या बरं का की म्यूट करा, तुम्ही म्यूट करा, डिस्टर्ब करू नका. करता येतं ना, हो येतं ना, पण तरी लोक कुणीतरी मध्येच येताना आवाज येतो बंग बंग बंग, मग पुन्हा म्यूट करायचं. पण ते करतो ना, पण त्याच्या आधी जे डिस्टर्ब होतं त्याचं काय 50 वेळेस सांगू नये. पण 50 पुन्हा
Should I start?
Please, sir.
Okay. And the COVID-19 has the mortality around 3%. So that is significantly low.
Sorry.
If you can see the mortality of the different strains. Now the types of novel coronavirus, if you look, it is of 3 types, A, B, and C. The type A is the closest virus which we have seen in pangolins and bats, and that is the route of outbreak for this virus. The 2 subclusters have been found in Wuhan and the common in America and Australia. This is type B is derived from this type A virus, and that came from the variation in the Wuhan strain. And this mutated slowly in China, but very rapidly outside China. And that's the place where still people don't know that why this is happening. And this B virus changes to C, where there is another mutation has been found, and that is the daughter of type B virus. So if you see, this is found in Europe and Singapore, and that's why this A virus changes to B and the B virus changes to C. So if you see here, there are so many strains which you originated from A. So you can see A has gone to A.1, A.23, and B, and the B virus has again mutated with one mutation at D614G, that is B1 strain. So that was one of the very hyped last year, December, you might have seen. And then you see there was one strain which we have seen in South Africa, California, and New York. They were partly or completely resistant to the known antibodies. Then this B11 lineage started, and these are the various ways by which we are still sequencing. And now R1, R2, P1, P2, and these strains are coming up in Brazil, Australia, UK, India, and so on. And if you see, so this is the original virus. So at 484 position, if you see, this glutamic acid has changed to the lysine with AAA. That is known as E484K mutation, and that's the mutation in the spike gene of the virus. And that's how the virus actually becomes highly antibody resistant, or whether it is having increased transmissibility, or whether it has a variant of concern, or whether there is something of the mutations which are still coming up. Now, if you see, this virus is still moving outside the different parts of the world, and wherever it is going, it is also having a different types of lineages coming up. Again, my screen has hanged.
It may be because of internet only. You can continue your talking.
Yeah, so these you can see here, these are the 3 strains which have been seen in UK, South Africa, and again Wales. So these are having these different mutations, B117, 501. V2, and we have 501 in terms of the vaccination program which we are having, and also making us to think beyond the regular strategies which might be responsible for the taking care of these infections. And now there are the various changes in this 117, 501 V2, and 501Y is coming up, and this is making the virus to further mutate, and that's how the various lineages. So if you see in the bottom picture, these lineages are giving the various newer strains like 501Y V2 strain, the similarly B11 V2 strain, and 117 V2 strain. So that's how the newer strains are coming up. So what is the basic difference in the normal flu and the COVID? So normal flu, if you see, it occurs every year, where the pandemics, if you see, it is only 3 times we have seen in 21st century, the 2002 SARS-1, then we have MERS in 12, and then now we have very recently COVID-19. Then if you see seasonal, that this flu can, people are accustomed to this. When a new virus comes in, people are not accustomed. For seasonal flu, people are healthy even can get, and for this the healthy cannot get. If you look onto the structure of the virus, so these are the electron microscopic pictures, and if you see here, there's a very clear-cut spike, yani that means a crown-like surface on the envelope area of the virus, and these are the T lymphocytes, which is green color here. And then whatever you are seeing outside is the egress, that means a matured virus which is coming outside the cell, and this is the way the virus looks like. So if you see here, the virus is actually having very clear-cut envelope. Then there is, I think still a lot of people are waiting in the room, and that is coming up on my screen. Can the host remove that also? Because that is unnecessarily creating the screen share hang again and again. So if you see here, there is the initially first structure was given by us, and then we have membrane glycoprotein. Inside we have a very specific nucleus capsid protein, and then inside there is a RNA, and this RNA is around 30 kb genome. So if you see here, there is ORF1, ORF1b, spike, ORF3, envelope, and then there are around 10 ORFs are found, and they basically encode for different types of NSP. So like they code for papain-like proteases, chymotrypsin-like the proteins 3C, main proteases NSP5, RNA-dependent RNA polymerase, helicases, and so on, and they are involved in the transcription and translation of the SARS-CoV-2. Now, if you see the origin and evolution for SARS-CoV, which we have seen in 2002 and 3, the virus was originated in bats, and it has been replicated in pangolins, and then it has transmitted from human to human. For Mars, it has gone from bats to camels to human to human. But for this new virus, SARS-CoV-2, we have been given a lot of theories, and still nothing is sure enough that whether how this originated. And of course the bats have been the source, but what is the intermediate host we still don't know. And a lot of theories related to foodborne, close contact, and so on has also been given. And of course it transmits from human to human. That's how we have seen. So when this virus came last year, we have started this work even before it came to India, and these two strains which you can see are the two patient sequence which we have got from the Wuhan, the meat market, from where the actual seafood market, from where the patient came in. So what we have found, they were very close to the bat sequences and also close to the previous SARS-CoV virus, which we have seen in 2002 and 3, as well as pangolin. And we have also taken some of the JV, which is indigenous in India, just to make sure that there is no contamination in the lab. We have done the various glycosylation related studies. So you see, once we have done, so the sequencing studies have also shown that this is 87% same So if you see on the top is the virus which we have seen in COVID-19 patients, and the bottom is the SARS-CoV which we have seen in 2002. And this is the area which you are seeing here. So this is the first structure which we have published, binding domain, and this receptor binding domain later on people came to know that was having a difference, but we have done the work which has shown that this is 87.2% same. And out of that 25% binding, so how this glycosylation actually happens? Because the glycosylation is an activity where the addition of glucose moiety on the cell membrane of the host cell happens. So this is the virus, and this is the how it basically, with the help of the glycan receptor, it binds with the host cell. And once it goes, it can be utilized, this knowledge, for either in glycoepitopes. It can be for making the novel antibodies, so that can be used for vaccination. We can make it, this knowledge, available for attachment inhibitors and so on. So that helps us to understand that how the antigen presentation happens, how the viral attachment happens, how the virus enters inside the cell, and so on. So all this work we have done in last 1 year. And if you see here, this is the picture from the glycosylation. And in the glycosylation itself, if you see, a lot of novel sites also we have seen. So this is the 2019 nCoV. On the right side, you see this is the previous 2003 SARS-CoV. And if you see, there were the various novel sites. So this suggests that the virus was very smart, that it has used the sites. So glycosylation is just like a entry door in a college. And for entering in the college, you need an identity card or dress code or something. So the virus has neither used the identity card nor used the dress code, and still it entered via bypassing the main gate. So either jump the door or something. So these are, if you see, so NVTW, NITR, and so on. So they were not present in the previous virus. So this suggests that the virus was smart enough to confuse the T cells so that they cannot catch it on. So then we try to see whether it makes the difference in the antigenicity. And of course, if you see the antigenic epitopes of 2019 nCoV were significantly different with the SARS-CoV. So a virus which is around 90% same with the previous virus, in spite of that, within the spike region, these many novel antigenic sites we have seen compared to the previous sites. So based on this, we have compared the spike structure. So this was the structure given by us in the January last year at the 1.39 RMSD value, and this was around 3.64. I did in top journals like Lancet, Science, and so many places. So this was the structure where we have compared. So you see there was a variation in the glycosylation, there was the variation in the antigenicity, but still when we have taken the newer SARS-CoV, this is the blue color, and the green one is the old SARS-CoV. So once we have compared, it was almost same structure, suggesting that a virus which was actually not the same virus, but still it confused the T cells by mimicking that this is the old virus. And that's how our system failed. So based on this work, we have been shown for the first time that this SARS-CoV-2 is closely related to the predecessor SARS-CoV virus. We have shown the novel glycosylation sites, and we have also shown the novel cytotoxic T lymphocytes epitopes in these viruses. So based on this, we developed various specific attachment inhibitors, which I'm not presenting today, and they're all available on the Google. So if anybody wants to see, so a lot of work we have done from there, that how this knowledge can be used. So the first vaccine work has been started, and then a lot of novel drugs work has been started. So if you see this, on December 2019, the China alerted the WHO that there are some cases of pneumonia-like illness with known cause in Wuhan. On Jan 7, this virus WHO reported to the world. Jan 11, the first death was reported in China. Jan 13, WHO reported the cases outside China. And Jan 23rd, our paper was done. So you see that the world level how fast we have started the work, and that was one of the very important reason to control the infection at a very early stage. And then of course the history that how the virus actually propagated throughout the world. Now if you see these are the international transmission patterns from December to February. But after this, once the last year Holi, if you remember, is happened, the virus has gone after that like anything. So everywhere on the world, it became pandemic within few months. Now, if you see the data on just 2 days back, there were around 232.78 million cases with around 4.77 million deaths. And there were around 33.72 million cases in India with around 4,47,000 deaths, confirmed deaths. Now, if you see, we have seen the first peak. Now, this year we have seen the second peak. And we are still saying that there might be a opportunity for restrictions given. And this is purely based upon the observation which we have seen earlier, where we have transmit. But if you see just 2 days back, India has shown is still the second number in the world with around 1,200 newer cases. But if you see the cases per million in India is significantly low. So that's a very important sign, and even the deaths per million in India. So although we are in the number 2 in terms of total number of cases, but is still the total number of cases per million and the total number of deaths per million are significantly low. So people should not be actually creating a panic that something worse is going to happen. But yes, you have to be attentive and take all the protection. Now, if you see in India, around 63.33% cases have been discharged. The active cases were around 34.12%, and the deaths were around 2.55%. Out of this, if you see the most of the cases are, this was taking care of the precautions, and still it is the same scenario. Most of the cases are coming in a same age group, 20 to 49 age group, followed by 50 to 69, and then senior citizen and the others were the lowest. Now out of this, the 75% cases were around in the males. So that is a very important thing, because the males were not only going out but also not taking all the precautions, as well as for the transmission of the virus. So how the virus replicates, as I have shown you this structure. So the virus actually binds with the ACE2 receptor, which is mostly found in the nasopharyngeal cells, and then it goes via uncoating. And then after the uncoating, if you see, the virus is free, and then it synthesizes all the different ORFs and the different types of proteins that go for maturation in the endoplasmic reticulum. Then there is an assembly happens, and then it goes for processing in Golgi. Then it makes the mature vesicles, and via exocytosis, the viral releases. This event is called egress. So how this virus is transmitted, we all know the virus is transmitted via droplets, and these droplets contain the virus. So you can, this can go to your nose, mouth, possibly in the lungs, but this has to have at least 1 to 2 meters of distance. This can also be transmitted via infected surfaces if there is some person in your community which is positive. So the primarily it is transmitted through large particle droplets. The distance should be at least 6 feet, contact with contaminated surface, and all the respiratory secretions and body fluids are considered as infectious material. These are some of the common sources from where you can get the infections. Somebody sneezes and coughs less than even 1 day, beginning 1 day in the children. The children have a little longer period of infectiousness, so they can transmit without being symptomatic. So they normally remain asymptomatic. So any close contact like this should be stopped, Any close contact like this should be stopped, and that's why people are using masks. And still after vaccination, we are saying the mask has to be used. So when somebody sneezes and coughs in front of you, you can see the virus goes inside your trachea, then it goes to bronchus and then bronchioles, and then there is inflammation of the lymph nodes, and then it goes to alveolar and alveolar macrophages. It settles here. Here it causes the inflammation, and that's how the mucus starts coming up. And when somebody sneezes and coughs, you can see the virus is also there, and that's how it transmits the virus to a new person. And once the virus goes inside your body, then the cellular immune response, which is comprising of Th1 and Th2 cells, gets upregulated, and these cells actually kill the virus, and also they activate the effector cells to produce the cytokines. These cells also kill the virus, and that's how the virus is cleared off. So a lot of people who got the mild or asymptomatic infection, this immune response was good enough. Whereas this also sends a response to the humoral system where the B cells are involved, and here it sends the message to the antibody secreting plasma cells, and that's how the viral elimination happens, and that's how the body makes the antibodies. Now, if you are immunocompromised or by any reason your immune response gets confused and not able to recognize the virus, or if there is a new mutation in the virus itself, then you might get a severe or moderate infection, and these are the patients who went to the hospital. So that's how the virus actually causes the disease. Now, what are the symptoms? If we all know that the incubation period is around 2 to 14 days, the infectious period is of the virus is exactly not very known. It is believed that the virus can be transmitted 1 day before 12 days following the illness of onset. Now, most of the patients have very mild symptoms. So they have simply fever, fatigue, dry cough, aches, pain, and so on. And then we have moderate cases like aches and pains, runny nose, and so on. Very few cases have, the very severe multiple organ failure where it can lead to death. So if you see, this was the very initial work which we have done last year in the patients, where in the first 3 to 14 days, we have seen the incubation period. In the prodromal conditions, patient might have 1 to 7 days, is fever, cough, sore throat, arthralgia, myalgia, GI upset, and so on. Then we have pneumonia and fever, lethargy, and so on. Then we have hypoxia and the various parameters like SpO2, and they fall. And then still, if it is not taken, so these are the different medications also suggested by us at the early stages. And then if this not taken care of, then it can go to shock, ARDS, and multi-organ failure, where acute respiratory distress happens and cytokine storm initiates, and then the patient might get death also. So when you should go to the hospital, so especially in children, if they have breathlessness, cyanosis, that means the skin color becomes blue, not drinking enough fluids, not waking up, not interacting, very irritable, flu-like symptoms worsen, and the fever with the rash might happen. In adults, difficulty in breathing, pain and pressure in chest, sudden dizziness might cause, so you should be going to the hospital. These symptoms are very common with common cold, flu, and allergies. So a good doctor can tell you exactly that what are new. So whatever you can see sometimes, and the very rare. So these are the differentiation for the doctors, that how we differentiate between the different types of diseases. Now, some patients who have very severe infections, they were either having some of these, so we characterized it. So now either if they had upper respiratory or lower respiratory diseases, cardiac diseases, musculoskeletal, neurological or toxic shock syndrome associated diseases, or secondary infections already existing, these patients have the severe infections. Now, if you see the groups which are at the high risk, so the children who are less than 5 years of age, the people who are more than 65 years or older, children and adolescents receiving long-term aspirin therapy, and who might be at risk for experiencing the Ray's syndrome, pregnant women, adults and children with chronic pulmonary, cardiovascular, and hepatic problem, adults and children who have immunosuppression, residents of nursing homes, chronic care facilities, and so on. So how we diagnose these viruses? As we know, there is the various types of ways by which the suspected cases might be where somebody has the symptoms and also visited to a place or a person or a country where the cases have been reported. The probable cases where a suspected case where the test for the COVID is inconclusive, or a suspected case for whom the testing could not be performed, and a confirmed cases where a person with laboratory confirmation has been done, irrespective of the clinical signs and symptoms. So whether you have symptoms or there are no symptoms, it doesn't matter. If the report is positive, you will be treated as positive. These are some of the ways by which we collect the nasopharyngeal swab and the throat swab, and the nasal swab, throat swab. We take the lower respiratory aspirate in the intubated patient. That means a patient which can come and go from the hospital, like from the OPD. And we take other samples like pharyngeal swabs, nasal washes, acute and convalescent serum, and so on in the patients who are who are not, able to go back to the home or have a serious infection. So what are the treatments in antivirals? There is no specific treatment is still available. Only most of the treatment is at the research level. So there are the various trials are going on where the phase 1, phase 2, and phase 3 molecules are there. There have been some emergency approvals have been given, which you might have seen in last year. Same thing has happened in the vaccine also. There have been the different types of vaccine. There are around 41 vaccine researches are going at the different stages. They might be DNA inactivated, live attenuated, non-replicating viral vectors, protein subunit. They are replicating viral vectors, RNA-based. They have the VLP-based virus-like particles, and some of them have not yet disclosed that what base they are actually having. Now, if you look into the clinical management of the disease, there are three types of management we do. Either we have the infection control, and then we have supportive care, and then we have the supportive treatment. So isolate the patients, implement the infection control precautions, PPE for the healthcare workers, and we also have administering the oxygen, mechanical ventilation, medication, and so on. And the corticosteroids is not recommended in these patients. Now, if you see, the novel therapeutic approaches have been tested throughout the COVID is still going on. We have also done a lot of work in these areas where serum therapy, monoclonal antibody therapy, adaptive immunotherapy, mesenchymal stromal cells, nanomedicine, decoy biomolecules, and antiviral drugs have been developed. Now, if you see there are the different molecules at the different stages, like these molecules can be used at the attachment or at the transcription or at the level of translation or at the level of maturation, so on. So that is purely on the doctor that how they are actually going to give you the medication. Now, if you see the IV fluids prescribed for fever and myalgia, patient is advised to drink plenty of fluid, avoid smoking. For sore throat, short courses of topical decongestant, saline nasal drops, throat lozenges, self-medication, कि चलो aspirin खा लेंगे. So don't do that thing. Do not take the medication without asking the doctor. And monitoring of the clinical and radiological evidence of the lower respiratory, that means the chest X-ray has to be done for the hypoxia and so on. So that's why if you go to the hospital as early as possible or go to the physician, you have a better chances of survival. So that means the prevention is the only option. Now, what are the ways of prevention? We have the vaccine, using the mask, keeping a 6 feet distance, and washing of your hands with soap and water. You might have heard this very popular dialogue, आज मेरे पास building है, property है, bank balance है, बंगला है, क्या है तुम्हारे पास? So we always used to say, मेरे पास vaccine. So that's the way the strength of the vaccine came in, and this is a strength of a country like India. We had a very early vaccines available to us, and that was another very important
Something went wrong, or sir? Deshmukh sir, I cannot see the presentation.
Yes, something is wrong with Dr. Shailendra. I think by mistake he has left the meeting. He will join. He will join.
Maybe his network might have gone.
Correct. Correct. He will join.
Yes, sir. It is really great to see Prakash Halami sir here.
Yes.
Good afternoon, sir.
Prakash Halami is there. Many other teachers are also there.
Yes,
So-
sir. Many are there, sir. That's so good, sir.
Correct.
Good
Shailendra
afternoon. Good
sir.
afternoon. Actually, I am traveling,
Okay, sir.
Yes,
While traveling, also you are
but
attending.
I
this-
wanted to attend that. This actually, I told Deshmukh sir I am going to Chandrapur, Gadchiroli, Bhandara.
Correct.
Okay.
Correct. Yes.
I am
Yes.
somewhere now in near Bangalore.
Yeah.
Very nice, Dr.
Very
Thakur,
good.
that you have organized this session.
Thank you
Interesting.
so much, sir. Sir, after some time, we will be inviting you also, sir.
Definitely, definitely. It's my pleasure.
Thank you so
Yes.
much, sir.
So some problem seems to be joining Dr. Shailendra. Can you call Dr. Shailendra?
Yes,
Nagen,
sir. Yes, sir. I'm calling.
you call him, some problem for joining him. Maybe because of the internet problem. This is the, you see, there is a beauty of digital, the online meeting, but there are some limitations or disadvantages of this online meeting also. We are fully dependent on internet. Although we can join from different places, but we are fully dependent on the internet. So it's all right. Many are here. Anil Kumar Verma, Anuj Kumar Tiwari, Chandrama Priya, Dilecta is also there. Manpreet Kaur from Rawal, and Dr. Prashant Kumar Mitra. So,
Sir, I would request you to tell something about MSI in the meantime, because
Yeah.
many of the participants, they are new or they have limited knowledge about MSI. So why don't you in this time tell us about MSI, sir, and what
why
we are
not?
doing?
Why not? I will be very happy. I am very happy to tell about the Microbiology Society India. Now you see, Microbiology Society India, although established in 1996, but today I can see that it's a golden era in India. Why? Many microbiologists are coming together, interacting throughout the India, sharing their knowledge. This year we have organized more than 100 online lectures. All are available on the YouTube of Microbiology Society. We have collected information of all Indians working outside India in microbiology and biotechnology. We have the list. If anyone is interested, they can visit the website. The list is uploaded on the website. We have prepared a list of experts in India. So more than 600 to 700 teachers. Why it is needed? Any one of you want to do research, or you are, suppose you have been sanctioned one project on nanobiotechnology. You can visit our website, see the list. You will get the experts in nanobiotechnology, their email ID and their phone numbers and everything. So, yeah, again, yesterday only, we have uploaded the all UGC approved journals on our website. In addition to that, we are having one book on website which is a free of cost. You can download it. The book is Handbook of Media, Stains and Reagents in Microbiology. So it is a free of cost. Now, I hope that Dr. Shailendra has joined. Dr. Shailendra, sir. Dr. Shailendra, please respond.
Yes, sir.
Dr.
I think he joined, sir. Let me
He
just
joined. He joined.
Yes, sir.
Yes.
I allowed him. I
Yeah.
admitted him.
Yes. And
Where?
Dr. Shailendra, sir, can you interact? Still problems are there. Okay. So unless
I guess, sir, the day we need proper internet, that day only it does not work. So that might be the case with
again you
Shailendra,
admit
sir.
him. Again you admit him.
Yes, sir. Yes, sir.
Because he is waiting outside.
Admitted him. Let me just. I don't know.
So I
Sir,
wish we could have this lecture again because it was with so much of disturbance. Like, half the things we have not heard
Yeah.
only.
Today there was so much
Yeah,
of
too much. Otherwise,
yeah.
Before we have not had that much of disturbance. Today is very much out of.
Correct. We'll repeat it. We'll repeat it. Don't worry.
Yeah, because
Because
it gets very frustrating when you get the first part of the sentence and then you can't get the connection.
Yeah. But I have given warning many times.
Yeah, I know, sir.
And it's my duty now to mute everyone because I'm spending more
Kindly,
time in.
kindly
the
allow
sir
me
is
to
here.
share.
Yeah,
Kindly-
sure. I will
Kindly
allow.
allow me to share.
I will allow. Yes, now you can share, sir. You can share. Yes, sir, you can share.
Yeah.
We'll repeat it because whenever we want to upload on the YouTube, it should be clear without any disturbance, without any noise.
I will send you the recording.
Yeah, yes, sir. You record it, without this platform, you record it and
Correct.
then send it.
Yes.
Yeah.
And I will upload
Without
it on the
disturbance.
Yes.
Yeah. Because it's very
YouTube.
interesting lecture, sir, but
Yes, sir.
we are so frustrated. Half the things we cannot hear only.
Even I am frustrated because every time I have to stop in between. So it
Yeah,
breaks
anyway,
the
it's
flow.
nobody's fault. It's nobody's fault. But anyway.
Maybe I hope the COVID will get over soon, so we'll meet in person, and then I'll
Correct.
give in
Oh,
person.
that would
this
be
talk.
great. That would be great. Meeting an eminent scientist like you would be really great.
Hello.
Hello.
Yes.
Hello. Am I audible?
Yes,
Yes.
sir. Mitra, sir, we
am-
can hear you, sir.
Very good afternoon.
Yes,
Good
sir.
afternoon,
I am Dr. Prashant Kumar Mitra from Gangtok,
Yes.
Sikkim.
Okay.
I am heading the Department of Medical Biotechnology of Sikkim Manipal University.
Which
Okay.
university, sir? Please.
Sikkim Manipal University.
Okay, sir. Thank you. Welcome.
Now, I have certain clarifications, but I am afraid I don't find the speaker.
I'm just coming up.
Okay. Now, my query is regarding the vaccine of
I'm coming
coronavirus.
to. I'm
see?
coming to. Let me. Can you hear me?
Okay.
Can you hear
Now
me?
we are having different vaccines. We are having different vaccines.
Can you
Covishield.
hear me? Can you hear me?
Hello.
Yes, we can hear you.
So let me
Dr.
finish.
Prashant.
Dr.
Prashant.
Mitra, your answer will be coming in the coming slides.
Okay. Yes. Sure. Please
So,
start. Dr.
Hello.
Shailendra,
Yeah.
please start.
Yeah, I'm just doing it. I think Dr. Mitra is not able to hear us.
Any,
No,
I can
yes.
hear, please.
Okay.
He can hear
Hello.
you. Yes, talk.
Just let me finish. All these questions which you have in your mind, I have already kept in the slides because we are getting it as a frequently asked questions. So I'm just coming to that. I'm just sharing. Just give me a minute. It's just taking a time today.
Okay. It's all right. It's all right. No doubt. So I'm very happy to see Dr. Prashant Kumar Mitra today. So keep in touch,
Okay,
sir.
Okay, sir.
Keep in
Thank you.
touch. Yes, yes. And our
Deshmukh sir,
Phone is here.
yes.
Okay.
Mitra sir is like our kind of guardian here.
Very
So
good.
he helped us a lot, sir.
Okay, Dr. Shailendra, your
Can
slide
you
is
see now?
visible.
Okay.
Your slide.
Sir, there are questions in the chat box also. Please see that you answer.
I will do in the last, and Deshmukh sir will ask me all those questions. So I
Correct.
will.
Correct.
So basically, we have different types of platform now for making the vaccines. So we have the full virus, or we are using the nucleic acid. So these are the RNA-based vaccines. We have oral vector-based, and we have protein-based. And based on these, all these cells are actually going and then presenting the virus or the viral proteins or the RNA, and that's how the immune response is elicited. We have two primary vaccines at the moment, Covishield and Covaxin in India, and a couple of more are also going to, for example, like of D, Sputnik V, and then Serum Institute of India is making another NVX-CoV2373 recombinant protein antigen-based vaccine coming from Biological E. We have mRNA-based vaccine coming from Genova, Pune, and then we have inactivated rabies vector vaccine, which is again coming from Bharat Biotech. You'll see in a period of 1 year, all of them will be coming to India. So there's a big buffet available with us that whatever we want to take, we can take from this. We are also
I guess he again logged out, sir. Disconnected maybe. Today, I don't know, like we started this lecture series and it was the first lecture, but unfortunately this technology is kind of betraying us, which is really sad. But how to say, we are not discouraged. We will continue this journey, sir.
Hello.
Yes, sir.
Yes. Can I ask questions in the chat box?
Sir, I think Saxena sir got disconnected, sir.
Again join.
Again join.
Should I ask the question, Saxena sir?
just 1 minute, sir. Can you see my slides?
Not yet, sir.
No, sir. No, sir.
Again, I have to share them. Can you see now?
Yeah, it is appearing. It will come.
So a lot of people had the question that whether the vaccine is really helping us. So of course, this is one of the, because a lot of cases we have seen that the patients who have been vaccinated also got the disease. So this is one of the patients who have been vaccinated and got the COVID infection later on. So there was a question always in the mind that whether the vaccine is really helping or we are just taking the vaccine and it's of no use. So this is the chest CT scan of one of the person who have been vaccinated and got. So whatever you're seeing here, you see the white lines. These are the ways by which we see the lung damage. Now, if I'm saying if there's another patient who have not taken the vaccine and got the disease. So if you see that CT scan, so these are the real pictures. This is the picture of another patient who have not taken the vaccine. So you see the difference that when somebody takes the vaccine, the loss, even if you are becoming COVID positive, the loss to your lung is minimal, maybe grade 1 or even lesser than that. Whereas if this happens, the chances of survival is very, very low. So this misconception in the mind that the whether vaccine works, the answer is yes, the vaccine works, because that is based on a lot of the studies which we have done. Now there's a big question that why people are hesitating, why they do not want to take the vaccine. So the vaccine hesitance is most important world challenges by WHO, top 10 challenges. It is one of them, and mostly because of the biggest obstacle in the vaccine taking is that the knowledge about the vaccine is very poor. The public perception that corners are being cut, and there is a lot of misconception given by the political people also, where they give, or religious people, that they give the misinformation about the SARS-CoV-2 and the vaccines. If you see, most of the vaccines are quite effective, have been showing estimated effect for at least 1 to 5 years at the moment. There have been mostly, if whatever the side effects which we have seen is 1 in 10,000 or 1 in 1 lakh cases, so that is almost negligible. The minor side effects is 1 in 10 or 1 in 30, that is like fever or pain at the site of injection. And most of them have been given the EU approval, and few of them have been given the full approval by the FDA in America, and in India there is a DGCA and ICMR approval has also been given. So these are some of the criteria by which people decide that whether they should take a vaccine. So the first thing, that are there any side effects? The second question they have in the mind, does it work? Third question, is it safe? And how much does it cost? Because if it is given free of cost, people might be willing to take. It is not because recently when the vaccine was given for free, a lot of states have said that that is a political agenda, or maybe because of the voting and so on. But that's not the correct estimation of the perception. If something is coming for free, people are willing to take it. Now, if you see the worldwide, in China, Brazil, and India, in the top 3 countries where most of the people are willing to take the vaccine, 87% people in India are willing to take the vaccine. So all the myth and confusion is only in the 13% people, and that is mostly because of those reasons which I have shared in the previous slides. Now, if you see what are the problems people are facing, so one of the very common problem they are facing is the pain at the site of injection. That is very common in other injections also. Fatigue, headache, muscle pain, fever, joint pain, chills, nausea, and swelling. And these are very minor features when a vaccine is given. And that's how we say that the vaccine is sure and safe. And based on this, we also suggest the people that what they should do after the vaccination, they should cover your mouth, washing of your hands, avoiding the crowded places, staying at home, keeping an arm distance with the people who are having any symptoms, sleeping well so that you become should not become immunocompromised, and drinking plenty of water so that even if you are exposed, the virus becomes highly diluted and it gets excreted via urinary system. What you should not do, you should not shake hands, hugs, or kiss socially, or use the social greetings. Do not take medications without consulting the physician. Do not spit outdoor. Do not smoke, it makes you immunocompromised. And do not use aspirin or other self-medication, even in children and in adults, both. And of course, using the mask is very, very important. And washing of hands with soap and water is also very important. The good thing is you might have seen one ad is coming on the television, कि क्या आपका साबुन slow है? So that is because earlier the WHO recommendations were that you have to wash your hands with soap and water for 1 minute, that is 60 seconds. But with the newer technologies which are emerged in the hand washing, it has came to 30 seconds, and you have to wash your hands for 30. So you have to count 1 to 30 in your mind when you are washing your hands, whenever you are doing it. And you can also use alcohol-based disposable and hand wipes if the water is not available. But washing of your hand with soap and water is the best precaution. Again, I am repeating it, with soap and water instead of hand sanitizers. So a lot of people were running behind the hand sanitizers. You should not be bothered if the soap and water is easily available. And a country like India, it is very easily available. So please wash your hand with soap and water again and again. And these are the various steps by which you have to do. So you have to put your soap, then palm to palm, back of hands, fingers interlaced, then the back bases of thumbs, fingernails, wrist, rinse the hand and dry hand. This process will be completed almost in 15 seconds. So you can do it twice, so it becomes 30 seconds. So basically the objective is that the soap should be on your hand for at least 30 seconds. So that is the objective of washing your hands. And it is a very important activity that in the different colleges, the hand washing day can be celebrated. So every student can actually learn that how to wash your hands. It's a very, very important protection against the COVID or even the various other infections. So one of the very important thing is how to prevent the newer cases so that we can prevent the third wave. That is the prevention in humans. We can do the prevention of transmission to humans and prevention of its spread so that it should not go. And that's how we make the this peak to the flat. So these are the various ways. So flattening the curve is one of the very important logo which Prime Minister have said last year, that how we can actually take care of, how can we take care of the COVID-19. And so what we can do, there are 4 P's: plan, prepare, prevent, and protect. So you can take some time to find out in your family and community who are at higher risk, who is the vulnerable population in your family, whether there is a school and university and childcare, what are the arrangements are available there, and at your workplace, what are the arrangements are available, and what are the facilities given by the government like free vaccination, COVID, Arogya Setu app, and so many other things, telemedication and so on is also available. Now prepare yourself that if this happens, then what can be done. So keep the medications and health supplies with you. You should know when to go to the doctor. You should know, should not send your children to the school if they are not well or if somebody else is not well. Alternative childcare arrangement should be there if you are going for work and if your kid is not well. And non-perishable items of food and water should be at home, because when you are not well, you don't feel to go to the market and shop and do all these kind of things. Prevention is another very important thing. So vaccinate for the diseases for which you are, compromised. Cover your cough. Prevent and manage the chronic diseases like asthma, tuberculosis, and some other diseases if you have. And washing of your hands with soap and water or alcohol-based sanitizer if it is not available, it can also be done. And then protect. Respond. That you should know that when to go to the doctor. You should know what are the symptoms. You should know who are the vulnerable population. So you can respond to that. So you can protect them and breastfeed your baby even if you have COVID-like symptoms. So that's the way you can protect your baby. So whatever antibodies are made, that goes passively in the babies also. So for stopping the pandemic, we have to train the people. Dem is a word for people. So dem means demos. That is the people. So how can we stop the panic and how can we stop so more and more, arrange this kind of lecture so that the people can become, so the panic can be stopped. If the panic is stopped, then of course the pandemic will be stopped. And this is one of the mobile number which all of you can note down. So even if some of the questions which remain unanswered here, you can always ask on this. That is 9013151515. And there is a toll-free number also which you can see, 1075 and 01123978046 and 1800112545. These numbers are not only for the corona but any infectious disease. If you see in your locality, you can ask on these numbers. And this is somebody can always say, see, my hands are very clean. So this is the way your hands are every time when you are after 1 or 2 hours when you are not washing your hands with soap and water. So that's the risk we have. Now in our hospital, we have initiated various online services. You can take the telemedicine systems. That is called e-Sanjeevani OPD, because a lot of people were saying that during the COVID, the doctors or hospitals were not available. So you don't have to go to the hospital. You can do this. This e-Sanjeevani app is available in the most of the mobiles, so you can download it from the the online platform, and you can do it wherever in India or a world you are sitting. You can take the prescription that whatever prescription you want to get, not only for the COVID, for any disease you can take this kind of prescriptions. This is the approach which we have developed for sending the vaccine to each and everybody, from where it comes from the manufacturer, then it goes to the beneficiary, and then from beneficiary there's an acknowledgement, then there's a QR code based certificate, and now there's a new thing has been developed where even if there is an error in your certificate, that also can be corrected with the OTP which you get on the mobile number by which you have been registered. So you can include your passport number or something like that if you want to go abroad. So that's the way we are still changing the COVID app. Now this is just a moment to thank all of you that because the COVID is there, so people can do a long distance wave. These are the newer ways of greetings. Elbow bump. You can use the sanitary gloves, and professor and the younger faculty can do like this, and 2 HODs can do like this. So these are the newer ways of the greetings for all of you, because the new year is coming up, and we are worried about the human infections. But if you see, we are also getting the newer infections in
It seems that again there is a problem.
Yeah, again I think it's hanged.
Yeah, again. Dr. Shailendra sir.
Yeah, although just there is 1 or 2 slides, it's just a thanking you. So basically, we are worried about the human infections, but now we are seeing the SARS-CoV-2 in animals. You might have heard the news in the Hyderabad Zoo. We have seen some of the cases in France and other countries. Also, we are seeing the cases. So now these newer cases coming to the animals, and might be because of the transmission. So till date, we were worried about the animal to human transmission. Now we are also worried about the human to animal transmission, and that's the place where the government and the various organizations are working to stop that. So the vaccines are not only required for the humans but also for the animals as such. I think it's hanged here, so I will thank at this moment, and I'm really sorry for a lot of obstructions today, and if there are any questions, I'll be very happy to answer. And there's one of the book which sir has already said. So if you put onto the Google, you might get that book on the net. And this is also available on the Amazon. So if anybody is willing to read that book, you can get it from there also. So
Thank you
very much. And
yes.
now
Thank you, sir. Thank you.
Thank you so much, sir. And now floor is open for the questions. So, sir, you will read questions or I should read?
Sir?
No, Dilecta ma'am will ask the question. Dilecta ma'am, she has put 3 different questions in the chat box. Dilecta.
Yeah, so thank you very much. It was an excellent presentation.
Can you hear me?
Yeah, can you hear me, sir?
Yes, yes.
Yeah. Thank you very much, Dr. Shailendra. It was an excellent presentation. So I would like, my first question is on one of the characteristic symptoms of COVID is loss of smell. So why is it so characteristic only of SARS-CoV-2?
Dr. Shailendra, are you there? Yes, Shailendra is there.
Yeah, I'm here.
So question is that why there is a loss of smell?
Very good question. So what has happened? Initially, we were not knowing that why there is a loss of smell. Now, very recently, a study has been done where we have seen that the genes which are actually responsible for the smell, they get down-regulated. And that has nothing to do with the virus replication, but that has mostly a part of the replication. So the cells where the ACE2 is actually found in the nasopharyngeal line, those are the cells which are actually responsible for the smell also. So just to downregulate the ACE2, the virus is, because that is used by the virus, it's a part of the immune response where the loss of smell is reported.
Yeah, thank you, sir. So before I go to my next question, I would like to comment on that picture that you showed about the two different lungs. That is one in the person who is vaccinated and the person who is not vaccinated. So that is a really, mind-blowing picture because if this picture could go viral, then I think there would be 0% of vaccine hesitancy. That picture is really important and it should go viral because only then when people see like that, then they will know what is the importance of the vaccine. So that was my comment. And my next question is, sir, can you elaborate on VLPs?
Yeah, people are making viral-like proteins. So these are the few vaccines which are in the pipeline, not by India, but some other countries also, where they have taken a rabies virus as a backbone. And they are trying to actually express the spike glycoprotein, where they have taken all those genes which causes the neurovirulence in the. So basically, they are using the rabies as a backbone, where they have taken the genes which causes the rabies disease as such, and they're trying to express the spike glycoprotein. So but these are only at the research level at the moment. They have not even reached to the phase 2 or phase 1. The preclinical studies are only going on. Nothing as much is done at the VLP levels.
So these are, the spike protein is like chemically synthesized and it is put into the rabies backbone virus. Okay.
Yes.
Achha. Okay, sir. And my third question is, what is Ray's syndrome, sir? When you said about aspirin.
Yes. Ray's syndrome is a multi-organ failure. There, what happens when somebody takes the aspirin, because when you take the aspirin, the blood-brain barrier, which allows the virus to go inside the brain, they become loose. And once they become loose, so there are the two proteins called ZO and ZM. So these are the two proteins which actually allows the virus to go inside the brain, and you develop the encephalitis and coma. So patients dies within few hours, 7 to 8 hours or maybe 24 hours. So a lot of patients you might have seen which has gone to the hospital with problem and they died. And then there was a big concern that the doctors have not taken care and so on and so forth. But the reason was this, so Ray's syndrome.
Okay, so that means the aspirin is actually enhancing the passage of the virus.
Most of the salicylates, yes.
Okay, sir. Yeah. I really did know this. Thank you so much, sir.
Yeah.
And it was an excellent presentation, but really it was a little frustrating. Yeah, thank you so much, sir.
Thank you,
ma'am.
Dr. Nagendra, please.
Yes. Sir, next question is by Dr. Prakash Halami, sir. He's asking, why do we get pain in arm even after a week of vaccination?
Why?
Why we get pain in arm even after a week of vaccination?
Normally normally we don't get the pain in arm after a week of vaccination. That is mostly if the person who is doing the injection is not very well trained, or there might be a site-based injury. So if it has not gone into the gluteal muscle, it has gone to somewhere left and right. Or while putting the injection, if let's say hand has been shaken, or the injection has been shaken or something. So these are handling errors only. Technically, there's no pains at the site of injury after 1 week. It might be for 24 to 48 hours, but not after that.
Okay, thank you, sir. Sir, next question is by Dr. A.K. Srivastava. He's saying, please elaborate herd immunity.
So the herd immunity is again a very important area where people are working. So what happens if you see when there are two ways by which we stop the infection. One of the important way of stopping the infection is that either you give the vaccine to everyone, or let's say if there are the 4 members, and if the 3 have taken the vaccine, the 4th is automatically immune because there is no way that he can get the infection. So that's the way the herd immunity works. So if 75% of the Indian population is vaccinated, the remaining 25% is believed that it will be protected. So that's the concept behind the herd immunity. It depends on various factors, which I have said, like washing of your hands, the precautions, the various vaccinations, or even the behavioral changes. That is known as, in our wordings, called RO. So that is the maternal number from where we calculate that how much risk a virus has to become an outbreak or endemic or epidemic or pandemic. So these are the various calculations which normally I take in the epidemiology class for the students. But it requires a whole understanding of mathematics as well as these numbers, how they have been done, because it's not a very straightforward calculation. But this is the rough meaning of the herd immunity. So when somebody says the herd immunity came in our community, that means at least 3/4 of the population is vaccinated.
Okay. Sir, next question is by Sampath sir. He is asking, sir, can you please tell us difference between Sputnik 5 and Covishield?
So normally the Sputnik 5 is a whole virion vaccine, and Covishield, as we all know, is a spike-based protein. So that's the basic difference. So both of them are the different platforms as such. You can say the Sputnik 5 is much closer to the Covaxin. So Covaxin is also the whole virion vaccine, live attenuated. The Sputnik 5 is also the same live attenuated. Only the thing is, it has been made by the Russian, and Covaxin is made by the Bharat Biotech and Oxford.
His next question is, why people who have taken Covaxin vaccine are restricted in some countries?
Why?
Why, like, people who have taken Covaxin is restricted in some countries?
Because the Covaxin has not, so that's a very important thing which people have to understand if they want to travel abroad, because every country has a confidence in their vaccine. And so there are two things. One is which I discussed here, is the vaccine hesitancy, and there is something called vaccine acceptance. Vaccine acceptance is mostly for the political reasons. Like, for example, so sir is from which university? Sampath sir?
Sir, I am Shanmugam, Dr. Shanmugam Sampath, sir. I am from Tamil Nadu, sir. Tamil Nadu Presidency College, Chennai, sir.
Okay, so let's say if you have to give in the admission of, MSc Microbiology students, and there are 10 options available, what you will encourage? You will always say that come to the Presidency College in your college, correct? That does not mean that your college is the only best college. So the same way in the vaccine program, every country which developed the vaccine, they put a lot of money in the development. So they want at least their country's vaccine should be taken on the highest level. So the first thing is, for that we have to show a lot of data. Covaxin has not been given those approvals yet. So WHO has not yet approved. And once the WHO will approve, then only internationally, every country has its own way of assessing the vaccine. They might say the sample size is low. They might say that this is developed by the India, and we do not want, we want like UK will always say that we want the vaccine which is developed in UK. US will say we will want the vaccine which is developed by Moderna. So every country has its own choice. So that's the way it is happening. So that's why the Covaxin is an Indian vaccine. It has been taken by the Indian government, and there is a confidence of the Indian government in this vaccine. International community are not accepting it because they still say the sample size is low. They have a lot of other questions which you can look onto the Google, which people have said about the Covaxin. So this is the personal choice. It is just like I want paneer tikka and I want matar paneer. So it is your choice. So the same way in the vaccine is, this is also very common, that what vaccine we should take. And this problem which will be much more as the year increases, because a lot of newer vaccines are coming up. So there will be a big hassle in deciding what should I take.
Okay. Sir, next question.
Thank you, sir.
Next question is from Srivastava, sir. He's asking why iRNA or interfering RNA is not used to eradicate the disease.
RNAi, if you understand, is not a very good way of eradicating a viral disease. RNAis are good for something which is genetically, if you want to modify something. In human genome, ACE2, like for example, even if I mutate the ACE2 is not just only used for the viral attachment. It is used for so many other things also. So RNAi is not used for anything which is naturally in our human genome. We cannot use it.
Okay. Thank you, sir. If there are no other questions, I have few questions, sir. Sir, my first question is why we are finding it difficult to find the intermediate host. Why in this case intermediate host is still not identified, sir?
Nobody knows the answer, because if we know that answer, we will be finding the intermediate host.
Okay. Second thing is, like, we know that this virus is getting mutated. So like for this influenza viruses in US, every year they give new vaccine. So why don't we do like that, okay, some kind of a cocktail vaccine we can give where the present strain spike protein thing and plus the few possible mutants which can occur, we can use those sequences for making the vaccines.
People are already doing it, but as you know, the vaccine development is not an easy thing. Normally it takes 10 to 14 years. It is very, very, because of the emergency approvals and all those regulations and down regulating the very stringent laws for the vaccine it has been possible, but of course people are doing. We know the virus is mutating. People are trying to create the in vitro models by which they are mutating the virus and seeing that what newer mutations can come up. And I'm sure within few years you will get the same thing, just like we have flu shot in America. The same kind of thing we'll be having for COVID also.
Okay, sir, one more question. First of all, can you explain a little bit more about cytokine? Because the picture of two lungs you have shown, and we know that people who have taken 2 doses of vaccine also, they need to be sometimes hospitalized or some deaths are also occurring. So is it because of this cytokine storm? And in this cytokine storm, which cytokines are what you call express more, and why not we give something against this cytokine storm?
We are already giving those things. So mostly TNF-alpha and IL-10 has been significantly upregulated. If you might have seen, I have shown one of the picture where I have shown the complications.
Yes, sir.
So those patients who died were already having some or other complications. So those are the only people who died. None of the natural people who have everything is fine, immune system was okay. Most of them were mild and moderate, and they all recovered. So the death was mostly because of some or other complications which they already had pre-existing, like asthma, tuberculosis, autoimmune disorders, or some other kind of problems which I showed you, muscular, neurological, epileptic, and so on in one of the slides. So they are the people. So we have categorized now that if the people have diabetes, heart problems, and so on, and other complications which I showed in that particular picture, they are the people who only died. Otherwise, the other people were not having that much of risk. They are mild, moderate.
Sir, my last question is, why till now we have not seen third wave? Because people are not using mask, and still majority of our population is not vaccinated, but we are not seeing really any third wave, which is very good thing for us. But what could be the reason?
See, normally if you see in that picture also, the third wave comes when you become, it is just like after first wave, people become a little reluctant, and then all of a sudden the second wave came. Within 2 months, the second wave went off because there were a lot of things and experience of the first wave with us. And as soon as the people will be vaccinated, or as soon as they will become reluctant, any of these things which are missing there, either the vaccination is missing, or if the reluctancy is there, then the third wave will come. So mostly the third waves always comes when there is the reluctancy in the vaccination program. In 1918, because the vaccine was not available at that time for H1N1, so the third wave was also very evident. However, in a country like Japan, Iran, and several other places, also a third wave has been seen. So I don't think that there was a hesitancy for the vaccine as well as there was a reluctancy in the behavior. But like Iran is facing the fifth wave, you might have seen.
Even
So,
US.
in the US also, correct. So that's why it is very important for us to understand that in spite of the vaccination, we still have to have all those precautions like washing of hands, keeping an arm distance, 6 feet distance, using mask, and taking the vaccine. These all are still important. A lot of people are saying, I have been vaccinated, why should I use mask? That's why you should use the mask. You should not go to the crowded place, or should not create a crowd, and these all kind of restrictions. Most of the time, if there are the rallies, there are the functions, there are the Durga Puja, now it is coming up, Dashera, there are, these kind of,
Yes,
where
sir.
the crowd comes in, then only the third wave will come. So wherever the crowd comes in, the third wave might be a reason for that. And that's why we are very worried when the government is saying, and there's a lot of pressure on the government to open the school, that if those many students will be coming to the school, and if something happens, then what? In America also, and some other places also where the schools have been opened, huge precautions are required.
Yes, sir. Sir, there are two more questions there in the chat box. Palas is asking, the WHO and other agencies are trying to find the origin of SARS-CoV-2. What are the methodologies used to detect the origin of virus?
There are several ways by which the origin of virus is detected. So we normally take the first cases from where, so like last year cases. We also take the lab strains which are used for the research. We also take the strains which they have reported in the various publications. We also take the strains which have been isolated from the various animals in the near vicinity. We also take the strains in the other people which are available in that country, from which are under the questions or under the scrutiny. And there are various other ways by which it has been found. So that's how we find out the patient zero, P0. And then from P0, we'll try to find out the A0, that is the animal or other way from where the virus has actually came in. It might be something directly came from the lab. It might be something came from the autochthonous infection. That means by error in the research. So many things can happen. So these are the various ways by which we look at how the virus is originated.
Sir, last question is, if someone suffering from the high blood pressure before the COVID-19 vaccination, what precautions should be taken?
Normally, if somebody is having cardiological manifestations or even the diabetes or something, we always suggest people to talk to your physician. And once the things are under control, then only take the vaccination. So there is a declaration form which you have to fill in and which will be filled by your doctor. So most of the patients who are having high blood pressure or diabetes or other things, they are already taking the medications. When these two things are under control, then only we suggest for vaccination. But if they are uncontrolled, we are not suggesting the vaccination till they are controlled. But yes, these people are at high risk, so the vaccination has to be done. So as soon as the things are under control, they should go for vaccination.
Okay, sir, one more thing. Many labs who are making like chimeric viruses, they are using this new technology called as Gibson assembly. And because of this Gibson assembly, it does not leave any trace. Like earlier, when people were using restriction enzymes for cloning, you can trace the origin or of the chimeric virus. But now, because of this new technology, it's very difficult to trace the origin of the virus if it is manufactured in the lab. So for that, is there any rule that when you are making, using this technology and making this kind of a chimeric virus, you should already inform the what you call funding agency or government agency?
Yes, normally they do. And not only that, it also comes as a part of ethics and IBSC approval that you have to give the full sequence of all those reagents and viruses and primers that what you are using for that work. And that is always kept as a record. So IBSC, at the time of applying for the IBSC approvals, if something very tedious comes in, like in a country like India, we have IBSC approvals, then IBSC also sends this data via online mode. So
sir, one more interesting question came up, sir. Halami sir is asking, I'm working on reducing the cytokines storm by probiotics. Does probiotic therapy will be useful?
I will say yes. A lot of people have used not only probiotics, but a lot of alternative methods, like for example, curcumin, longa, and so many other things where people have used and they have shown. And otherwise also it has been shown that a lot of antioxidants also play a very important role in down-regulating the cytokine storm. So there's no harm in taking the probiotics as well as alternative routes. But of course, the problem is that in allopathy, we cannot suggest something which is not prescribed by the FDA or DGCI or something. But if anybody wants to take, of course, there are the doctors from these areas which can prescribe all these kind of things.
So I guess now we don't have any other questions. So with that, thank you so much, sir. Now I will request our Dean, sir, Professor N. Satyanarayan, to say a few words or concluding remarks. So please, Satyanarayan, sir.
Thank you, Dr. Nagendra. I think we must recognize that the technology is not on our side today. So, and therefore, it's also, we have also pushed into the lunchtime. But nonetheless, I think this was a very, very informative and extraordinarily made lucid lecture by Dr. Shailendra Saxena. And then we, I think, understood a complete trajectory of this virus, right from its origin to spreads to projections to prevention. So he has covered a wide range of aspects and given us sense in this case. So this is particularly the RNA viruses is dominating the World Health Organization's list of 10 most global health threats, etc. This kind of unprecedented can always happen, and there has to be adequate preparedness. But unfortunately, with regard to virus diseases, we have observed that this preparation has been kind of probably to the dynamics of the virus or our own lack of collective efforts, this has been lacking. But in case of COVID, SARS-CoV-2, at least we saw that there was a very, very good collective effort by the global community, not only to find the vaccine, but also to mobilize the global resources to develop protective measures to save the humanity. So we have successfully developed this virus vaccine, and then we are trying to work on that. However, we all know this delivering this single dose vaccine to establish COVID herd immunity. This requires a lot of unprecedented efforts. I'm sure we all need to drive this process with considerable will as well as a good education amongst our community. In that regard, Dr. S.K. Saxenaji's 2 books, perhaps, and a lecture where he gives a very clear message and tips to plan, prepare, and prevent and protect from COVID has tried to reassure us that we all can move in a right path, provided we take sufficient care and also educate our own fellow colleagues. I congratulate Dr. Saxena ji for delivering such a lucid and a very informative lecture. It was understandable by everyone. It need not have to be from the science. Community. It was made very, very. Thank you very much for being with us. I also congratulate Professor of the Microbiological Society of India and Dr. Thakur for undertaking these endeavors. These are important in this very critical juncture. On behalf of School of Life Sciences, Sikkim University, I thank Microbiology Society of India profusely for choosing us to host this lecture. And we also look forward for many more such initiatives from your organization in our university, sir. We welcome for any such initiatives, and we extend our full cooperation from the school.
Thank you very much, Dr. Satyanarayana. I will be very happy to come sometime to the university and give this talk there in person. I'm really sorry today for a lot of thing, and I will be very happy at that time. Dr. Deshmukh can also come and we can join there in Sikkim itself.
Sir, sir, definitely we will invite you here. Once the situation will improve, we will invite all of you, sir. And thank you so much, Satyanarayan, sir, for concluding this talk and like your views in such a nice manner. You have concluded this talk. So thank you so much, sir. And now I will request Dr. Sayak Das to give vote of thanks.
Thank you, sir. First of all, I would like to thank Professor A.M. Deshmukh, sir, President, Microbiology Society of India, for giving us this platform to give and organize and host this beautiful lecture series from Northeast India MSI chapter. I would like to thank our Honorable Vice Chancellor, Professor Avinash Khare, Registrar, Sikkim University, Dean of Life Sciences, Professor N. Satyanarayan, HOD and Professor, Head Department of Microbiology, Jyoti Prakash Tamang sir, for giving the permission and also helping us with encouragement to organize this beautiful lecture series. It would be a very great honor for us. It was a great honor for us to host Professor Shailendra Saxena sir, and it is indeed a great pleasure that sir gave us a very good lecture, a very interesting lecture to all of us. Today's COVID is a very big mystery with days passing, but the amount of knowledge disposed in this platform is immensely valuable to all of us. Thank you, sir, for agreeing to give your valuable inputs, for illuminating all of us with your most valuable lecture. Next, I would like to thank all the other dignitaries, respected professors, faculties, young scholars for attending this lecture and making it a successful. Next, I would also like to thank President, Northeast India Chapter, Dr. Nagendra Thakur, and all the other state coordinators and members from Northeast India Chapter, Microbiology Society of India, for attending and giving valuable suggestions, questions to everybody for us for answering them. So I would like to thank each and everyone for your valuable participation. Thank you.
Thank you so much, Sayak. Sir, Deshmukh sir, would you like to say a few words finally?
No. It was an excellent presentation. Really, we have enjoyed your presentation and many doubts were clear.
Yes, sir.
So although there were some disturbances, but we'll neglect it, and overall performance, overall presentation, overall learning by the attendee was at excellent side. Thank you.
Sir, from
Thank you.
our MSI side and Department of Microbiology, हाथ जोड़ के मैं सबका thank you बोलता हूँ. Thank you so much, and we are looking forward for your participation, everybody, in future also. So धन्यवाद आप सभी लोगों का बहुत बहुत धन्यवाद.
Thank you, sir. Thank you, sir. Thank you.
Thank you. I will request Dr. Shailendra, please provide us a recorded lecture.
Yes.
Or otherwise we'll edit. Otherwise we'll edit this lecture. No problem.
Okay.
Okay.
Sir, editing will be not that good because still it has some issues. If sir can provide us recorded,
that is always
that will be
better.
really great, sir. So please, we really request you to give us this recorded video of. Thank you so much, sir, and we are looking forward to see you again, sir.
Thank you.
Thank you. Thank you. Thank you.